And I want to dive right into the panel discussion. I want to dovetail on some of the things Kirk brought up. So while they're coming up, I'm just going to introduce our panelists here, and I'll go down the line here. We have Reatha Clark, who is a partner at PriceWaterhouseCoopers Healthcare Advisory Practice, works mainly with hospitals. And we have Justin Barnes, who is the Vice President for Government Affairs at Greenway Medical, a well-known health IT firm here in Georgia. Dr. Bill Custer, a healthcare economist from Georgia State, also works in their Healthcare Policy Institute. Alan Moseley, who is a partner at Noro-Moseley Partners, a well-known venture capital firm here, heads up their healthcare practice. And then on the end, Dr. Ed Becker, who is from the Emory Rollins School of Health. So thank you guys for joining us. I think it's going to be a great discussion. And what I want to do is just jump right in and, like I said, take off on some of Kirk's comments. And I guess the first thing I would kind of throw out to you guys, and this is thrown out to the panel in general, so whoever has the first idea, speak up. Elaborate a little bit on what you feel is the top, or one of the top concerns that healthcare is going to have to face in 2009 as we emerge from this crisis, or it can be a subsector of healthcare, but specifically related to the financial crisis.
I would say I don't think there's going to be any emergence from the crisis in 2009. And I think we're in for a long, tough year. I sat in on a presentation at the Federal Reserve, and they were predicting we wouldn't feel a lot of improvement until 2010, maybe even early 2011. So I think we're in for a tough year all the way around. So I think that it is organizations that have that strong balance sheet that Kurt talked about are going to behave differently than those that don't. And can those management teams be agile enough to deal with the uncertainty that's coming? We don't know what the new regulations are going to look like. We don't know where the bottom of this crisis is. And management teams are going to have to make decisions quickly with imperfect and incomplete information and move on. And it's going to be a very, very tough time.
Yeah, I think what I would add to that is if anybody ever saw that Sequoia Capital PowerPoint from about 4 months ago, they're talking about this I guess shift in economy could last up to even 7 to 10 years. I don't know that's going to go quite that long, but I certainly do see 2009 being a difficult year for people who did not plan ahead, and for people who waited to adopt technology, even to modify their infrastructures, or even streamline their operations. If they waited, they very well could have a tough time in 2009, even 2010. For the companies that did think ahead a little bit, did streamline their operations, adopt the proper technology, I think they very well may weather this storm certainly a little bit better. And I know there is some policy relief coming from the administration. So I think there's certainly hospitals and physicians can look for that. Not quite sure the size of that package in the $10 to $20 billion range over the next couple of years. But I think that that will certainly assist. You got the TARP program that hit the banks. $350 billion of that has been dispersed, or about to be fully dispersed there. I think you have another $350 that might be dispersed in the coming months, so that will certainly shore up a little bit of the financial sector. But I think you still need to see some relief hit in the individual homeowner. I think that the banks had received a lot, the insurers had received a little, but I think that we need to see some of that trickle down to the individual at the personal level to really start to fuel this economy just a little bit more. But it's going to be a rough 12 to 18 months, in my opinion.
Well, I agree with that. Is this on?
Yeah.
I agree with that. As Kirk said, there's several whammies coming. Historically, health expenditures or health spending has lagged behind a fall in GDP by 2 to 3 years. And while this is the statistical numbers are so slow, this is anecdotal. In the early 90s and the early part of this decade, that lag is getting shorter. So what you expect is that economy-wide health expenditures would begin to slow in a major way in the summer. and perhaps continue. The second part of this is that you might have heard the statistic that every point in unemployment yields 1 million more uninsured Americans. Well, I think that understates the case. We have had a decline in coverage throughout the 21st century. And that decline in coverage has been coupled with an increase in coverage in the Medicaid program. And of course, in every economic downturn, we see a large increase in Medicaid. And a big part of the stimulus package that President-elect Obama is proposing is a large increase in the match program to state Medicaid programs. About $200 billion of the stimulus program goes there, but it runs right into state government. State governments, of course, historically always have trouble in recessions. Their revenues go down. They can't deficit spend. They find ways to cut, and Medicaid is often the way they cut. The stimulus package doesn't give dollars to the state. It gives matching dollars. So as the states say, well, I can't spend this money, that matching dollars go unused, go wasted. And it's going to impact the healthcare sector dramatically, I think, in 2009. It's going to be a major battle because, as we saw today, there are other uses, especially in Georgia, for state dollars. Transportation heads are asking for more money. So there's going to be a major battle over the Medicaid program. And the governor of California said, well, I don't care if we get a match. I don't see any stimulus in Medicaid, which I think is faulty reasoning, but reflects what state governments think.
I'll just echo a couple of the comments that have already been made. I mean, when we look at our portfolio companies, clearly the hunker down mentality for 2009 is the theme. The old business school comment you heard when you walked in your finance class the first day, cash is king, that is more true today than it's ever been. And I think that you would be shocked at sort of the capital crunches that are happening with in the lack of lending that is going on out there, which does impact a lot of healthcare services companies, as everyone here knows. I think 2009 will be a very difficult year. I think the scary thing about healthcare versus if you're selling software to banks, for example, you saw immediate impact. I do think there's a bit of a delay, and I think we could be seeing the impact of this really start to trickle down more towards the back half of this year and even into 2010. That's not to say that we do about 40% of our investing in healthcare, and I do want to maybe say one positive thing in the room, which is that healthcare is still probably a better place to be than a lot of other places that we see. It will be impacted. It is being impacted very significantly by what's going on out there, but I can assure you that there are other sectors that are absolutely getting killed right now. Our healthcare portfolio is holding up fairly well during this, but anyone who thinks it's going to get a lot better anytime soon is, I think, fooling themselves.
So, Alan, let me add on to that. We're a technology organization talking about lagging indicators that Dr. Custer mentioned. Healthcare has notoriously lagged behind as far as technology goes on compared to other sectors out there in the industry. So what role will innovation have specifically in healthcare as we emerge from the crisis, and how will the health IT sector specifically fare as we start to come out, say, 2010, 2011, something like that?
Well, I mean, I think there are so many unknowns right now, especially related to the new president and what that will bring. I think there's a lot of talk out there that healthcare IT will be positively impacted by that. And I think it will. If you look at Athena Healthcare, which has probably been one of the few bright spots in terms of IPO and healthcare IT, the stock has held up pretty well over the last year. And I think that's because people believe that with Obama there will be more of a push for a lot of the things that everyone's been talking about in healthcare IT for a long time. But reality is that that's just talk right now, and it really is going to come down to dollars and whether people said, as Kurt said, the discretionary spending required, whether they can do it. If they're just trying to survive right now, even though it sounds good and even though there might be a government stimulus in that respect, it's still going to be a very difficult 12 to 18 months. So to answer your question, I think healthcare, the huge role for healthcare IT and innovation. Timing is very good from the perspective of Washington, which really does drive a lot of what happens in healthcare. But still, the next 12 to 18 months, hard for me to see how you're going to really see a big impact in terms of dollars.
So let's talk about that kind of 800-pound gorilla, if you will, and the stimulus. Justin, you mentioned that. Dr. Becker, I'm curious what your viewpoints from a health policy standpoint, not only from the IT infrastructure that we're hoping to receive in terms of stimulus and try to stimulate the economy there, but what about other areas such as Medicare, Medicaid, and funding in those areas?
Well, I think at this point it's quite difficult to say with the new administration coming in, and I would echo many of the concerns that have already been made. I think Obama said, we can't live with the health system that we currently have. And I think, if you look at from, say, the public health standpoint, we spend, 2.4 trillion, I think, in 2008 was the estimate. We still have, 17% of our population's not covered, about 47 million. And when you look, for example, at things like, I was looking, for example, 1 out of 5 children, about 20% of the kids in this country live in a family under the poverty level. So a family of 4, that's $20,000. And what I see in this administration a little bit politically is the opportunity for that 47 million to be part of, if you will, the Democratic Pale. In other words, from, say, a public policy standpoint or from a public health standpoint, if you look back over history, and again, I'm talking about like Bismarck and what they did for the health of the country. I can see a real push on the part of the Democrats to incorporate a much broader coverage than what we had. And from what I see of that administration, Barack is saying, we can't solve this problem with the old system. We need a new system to come in. So I see something pretty big, bold, and breathtaking coming in terms of what that is. And I think the implication of that will be sort of substantial amount of money, but a lot of money go towards, I think, reorganization of what we now have and what we see.
Justin, I'm sorry, I'll let you, because I wanted to tag on something on there on the IT side. What about, we look back to the Bush administration, and we all know there was the 10-year timeline. By 2014, we want to have full adoption of EMR and so on, and further adoption of IT throughout healthcare. What makes us think, or how do you feel from a policy standpoint that we can do that in 2 years, and what is it going to take to get there?
I think that to pick up to where he left off and also where you just brought us, I think we're going to see an investment. We have to take everything in stages and kind of slowly here. We had a lot of increase in standards in the healthcare sector in the past 4 or 5 years. We had certification of health technology over the past 4 to 5 years, and we made a lot of progress in that area. And I think that you're going to get a stimulus investment in healthcare in a couple different areas, in also stages. The first stage will come in an HIT investment. That's the $10 to $20 billion over the next 2 years. And then you'll see more of a healthcare reform platform, because you can't just throw money at the problem. We have to kind of eliminate some of the inefficiencies in healthcare to help pay for this healthcare reform that we need and to cover the 47 million Americans that aren't covered right now. So I think that we're going to see a couple of different stages. And what we have to be careful of, and what actually I'm going to address this afternoon, is that you don't kind of throw the baby out with the bathwater. We kind of got to build on the framework that we've created nationally with standards. It's HISP and CCHIT if you're into the levels of the industry at that level there. But and we have some great interoperability standards. This just takes time. It takes maturation, and that's kind of where we're at. And we actually have technologically we can achieve interoperability today among many leading systems. But now we're at the provider level, the sharing of information, doctor to hospital, doctor to doctor, ambulatory to ambulatory practice. That's a part that hasn't been finalized yet. And so systems can share information, but you got to get the providers to want to share information and incent them to share information, and that's where we're at. And we just don't want to go ahead and make all these technological changes because we haven't seen interoperability throughout America when it's actually not to the technology level. We have some technology advancements still to make, and we will continue to improve every year, but we got to be careful there. So.
If I could just pile on to that, they have a chicken and egg problem. Kirk mentioned the fact that a lot of industry leaders don't see a return on investment in health information technology. You can demonstrate in cases where this is a great thing and conceptually how it could save money, and certainly President-elect Obama ran on a platform that health information technology would help fund a lot of the reform he's going to do. Until you have organization or until you have the healthcare delivery system integrated to a point where the return on investment is actually observable, it's going to be very difficult to spend that money, to get organizations to accept that money. we live in kind of a grand and terrible time. As Kirk said, that there is a terrible crisis which may lead to a major paradigm shift. And I imagine, actually, that each one of us in this room have in our own heads what we think that's going to be. But what it actually is completely unclear. But it is possible. So I'll just use my own head. It is possible that an attempt to bring all Americans coverage, to create systems where we have universal access to health care, you would integrate the health care delivery system in such a way that the return on investment on investment in technology would be clear and immediate, and you'd get that investment by the actors. But until that happens, there's going to be a lot of resistance, and just putting out grant money or stimulus money isn't going to make it happen.
I want to change gears just a little bit and get back to another topic that Kirk mentioned. And so, Reatha, I'm going to throw this to you and anybody else chime in that wants to. But specifically talking about hospitals and the situation there, I think hospitals have probably felt the brunt of the credit crunch for longer than a lot of the healthcare sector, the rest of the healthcare sector, and even the rest of the economy maybe. But I was looking at a study and some data from the American Hospital Association, and there's significant indicators that hospitals are going to cut expenditures, investment expenditures in things like technology, clinical technologies, physical expansion, facility expansion. But one of the main effects that they felt, or the real hurt that they felt, is involved with their debt portfolios and managing their interest on their variable rate bonds. So how does that play out now? What are some things that hospitals have had to do, kind of tagging on what Kirk said? But then as we go forward, 2009, and then hopefully try to start emerging, what is the bond situation going to look like there with hospitals?
My crystal ball is no better than anybody else's. But hospitals are polarized in this situation. We have, because of the way the industry's evolved over the last 10 or 15 years, we have haves and have-nots. There's two groups. And so broad statements about the whole industry are not going to hold true for half of them. They're really in very, very different situations. But what is common is the cash is king. And I have had 3 people, and physicians were 2 of them, say our system's highest priority is protecting our bond rating right now. And for a doctor to understand that, an employed physician to say, my job is to protect the bond rating right now, it tells you that is the priority. So if you're selling into that market, if that is who your customers are, you need to figure out which side of that coin is each customer. Are they a have that's on a slow-down strategy? A better value proposition is going to make them go forward. An implementation or a change that's going to help them protect their bond rating, that's going to improve their margins. They may do those. The people that are on the have-not side are shutting down essential programs, and people are going without services. And I think you've got to think about where each provider sits. I wouldn't make a prediction about where the bond markets are going to fall out because I think it's way too uncertain. Remember, hospitals had trouble accessing capital when the economy was good. So it's downhill from there. And
I guess just to tack onto that, we're already seeing a number of hospitals shut down, those have-nots, if you will. And in terms of, back to Kirk's point about having that cash and then gaining access to credit, can we speculate a little bit or elaborate a little bit more? What's the impact on, from an economic standpoint, to the community level? When these shut down, what does that mean even for the broader economy?
Over the years, I've done a lot of work on indigent care and patient access. At the patient level, it means people in some markets are going to have to travel farther for care. We're going to have people, you're going to see, people dying on the way to the hospital kind of stories in the media. It's going to. I think that in some areas it will be very dramatic. I think you can expect it to be worse in rural areas. I think we're going to see, particularly in the Atlanta market, some much-needed consolidation that we haven't had before. Because some of those haves are going to take the opportunity to merge, acquire some of the have-nots. Because there is still demand for that service. There's just not financial strength to deliver it. So I think we'll see some consolidation. Don't think that'll happen very soon, but I think you can expect that. Some mergers, some consolidations, some service rationalization, which overall I'm a glass half full person. I think some of this will be good for the industry. Some of the things that we couldn't get done in different markets will happen because there's a burning platform to make them happen. That consolidation, that elimination in other parts of the country where there's duplication of services, where there's excess capacity. I think there is some good that's going to come out of this in the long run. It's just going to be painful getting to it.
Here's a kind of a very direct question. One analyst, Wall Street analyst, said that for-profit hospitals are going to be a thing of the past as we emerge. Can you comment?
Are we going to turn it over to the audience soon? Because I'll say something that will stir people up. I was in a session with some people who were trying to do some free thinking about how to pay for the Obama plan, because that's really the great weakness, is whereas how the savings are going to lag, where do you come up with that early money to pay for the plan? And one of the people who was in that group said, isn't it interesting that the exact tax bill, if you converted all not-for-profits to taxable, their federal tax bill in the aggregate would be the same as the cost of the unfunded cost of the Obama plan. So, are tax-exempt hospitals a thing of the past, or are for-profit hospitals a thing of the past? I don't know.
Well, we are going to throw it out to the audience in just a minute. Before we do that, I'll let everybody cool down a little bit. Alan, you mentioned your portfolio focusing on healthcare, and performance hasn't been perhaps as dire. What does it look like, or what is your speculation on capital coming into the markets? Probably 2010, but how is that going to come down? Mainly geared towards hospitals? Is it going to focus on IT? Is it going to focus on the uninsured? Can you elaborate?
Well, we're when we think of capital coming into the markets, we're thinking about more from our perspective and investing in sort of innovation and early stage companies in this world. It's hard not to be negative right now. I mean, I was going through some numbers last night just for fun. Valuations, forward P multiples across the healthcare services industry for all of 2008 have been cut in half. There was an article that came out that said 100 of the 350 biotech companies will go away in 2009 and 2010 because of lack of capital, and so they will either shut down or sell their technology. So you're operating in an environment like that. Liquidity right now is just stopped. There was one public healthcare services IPO in 2008. That was in January. So there has not been a single healthcare services IPO in almost a year right now. And then the strategics, because their own multiples have been cut in half, because of their own capital issues, how do you think they're looking at the M&A environment right now? So you have that sort of environment in which you're trying to invest. And we are supposed to be looking out 3, 4, 5 years, but I got to tell you, it's hard right now. It's an emotional reaction to what's going on. So in terms of our world and capital coming into the market, 2009 is just very tough. I mean, we are you're not supposed to be risk averse as a venture capitalist, and we're not risk averse, but you're dealing with the context of everything I just described, and it makes it a bit more difficult. The hope is that things start to turn around at the end of this year. The hope is that the IPO market at some point will return in 2010, 2011. It's funny, we invested in a company, medical device company. It's a phenomenal company. It's a company that's had 300% growth 07 to 08. They'll have another 200% growth in 09. It would be a perfect IPO. When we invested, the IPO was supposed to be Q1 of 09, Q3 of 09. Now I'm hearing Q2 2010. And I just think to myself, if a company like this cannot get public money, what are all these other companies doing? How are they going to get capital? So in our mind, we are very focused on capital intensity. We are focused on how Noro-Moseley and whatever syndicate we're in can make sure that this company can get to profitability within the context of this environment and with all the risks that are out there, especially around reimbursement. I think one of the other really interesting questions that's going to happen, our job is to fund great private companies, and I think the role of the private sector versus the government sector could be very different with Obama than it was with Bush. Take Medicare Advantage, for example. I think that's a program that could be in big trouble under the Obama campaign, and that's a great example of the private sector supposedly taking on some of the burdens of the public sector and the efficiencies of the private market supposedly making it better. That whole attitude could be very different over the next 4, 5, 6 years, which really could impact our business pretty significantly.
The only thing I want to add to that is kind of to carry on the have and the have-nots. In addition to being vice president at Greenway, I'm also chairman of the Electronic Health Record Association. And even the end of last year, we noticed a lot of companies. I mean, we've been very blessed here in Georgia, and our growth has been in the 80-90% range quarterly over quarter. But there's a lot of companies in my association that have not seen that. And I actually use the exact term in the past quarter, we are an industry of have and the have-nots. We certainly see a third of the companies in my sector that have seen between a 20 and 30% decline in sales, and this is even a little bit before where we are right now. And in the past, I would say even 60 days, that decline has certainly increased. And then we have about a third of the companies that have stabilized. But if you're not seeing tremendous growth, then we have the rest of the companies that have seen good growth. I mean, I know that Athena and NextGen and Allscripts, other and GE a little bit, we've all seen anywhere from some of the public companies 20% growth, 15% growth to ours, which is around 90% growth. We've been able to witness that, but again, it's the have and the have-nots in our industry, and you got to focus. Your target. You actually brought up great targeting. I mean, you're looking for physicians who want to run a good operation, a hospital that wants to run a good operation, and try to convince them of why it's important to adopt technology and streamline costs.
So let's talk about one last question before we throw it out. Let's talk about physicians specifically, and Dr. Becker and Dr. Custer, I'm going to throw this out to you, but I was looking at a statistic from Kaiser Foundation that 36% of Americans are postponing needed care, and another 30% are skipping tests and treatments outright. So that tells me two things. One, there's going to be an impact on health and the quality of Americans' health care, and two, that means doctors are seeing less patients, hospitals perhaps are seeing less patients, but something's being thrown off there in the supply-demand chain. Can you comment on that?
Well, clearly, I think as the patient catches cold, I think the physician might freeze. And clearly, as Kirk was saying, I think it ranges across different specialties. Some of the specialties like plastic surgery or those that are more elective than really urgent are going to see much more of a decline in their revenue and in the patient loads that they have. I think for physicians in sort of general, they're faced with the same sort of troubles that we all sort of see coming, and many of them I think look to you or look for organizations like you to basically bring value or provide them, for example, whether it be electronic medical records or sort of different types of if you will, technology innovations that are going to help them and save them money. And I think what we've seen, in terms, I was looking at the Center for the Health Studies, Paul Ginsberg was looking at the diffusion of technology and the rate at which physicians were taking on technology, and the growth was very slow, very small. And it was mostly in the bigger, larger, sort of firms. As you go out to the rural areas or some of the places where you might argue we're really going to need it, where there's going to be the cutback, they're very, very reluctant to do it. I mean, in capital there is an issue, training, all the kinds of things I think you see. But on the other side, I sit on the medical practice committee at Emory University, and we meet once a month, and and we're putting in new electronic medical records, and I think many of us see that as sort of a saving grace in which we'll be much more efficient, much more effective, and much more able to serve those patients and provide them with the kind of services that they now are much more difficult to get. So I think it's sort of a mixed bag for physicians as it comes down. I mean, clearly for physicians and their patients, seeing lower demands or less patients is going to cause them revenue, but still see opportunity here as well.
One of the fundamental changes we've seen in the healthcare delivery system over the last 20 years has been physician practice arrangements. The healthcare cost and inflation and the changing in the way people pay for healthcare have made the kind of Marcus Welby, Cliff Huxtable model of physician practice obsolete. Physicians have been slow, but have been moving toward larger organizations, multi-specialty, clinics, closer ties to hospitals, and Kirk talked about that in terms of what's happening just in the last month. As we enter a crisis, we'd likely see that change accelerate. We're likely to see much fewer physician offices, much larger physician practices, and frankly, that's an opportunity for technological innovation that has fallen on deaf ears or simply didn't see the return on investment or let somebody else put it in for me. I don't want to learn a new system. Once they're in a new payment structure, that resistance is likely to soften. And I guess the other part, to go a little farther into Obama's health plan, is that after the giddiness of stimulus packages and new reform, there is going to be a need to pay for this. And the tightening of the screws on reimbursement is going to be based on information. There's going to be a lot more pay-for-performance types of arrangements, which is going to require a lot more information to be exchanged among providers and between payers and providers. And so there's an opportunity that is likely to present itself in the near future as well.
Great.